Okay, so we're recording now. Um, and I'm sure everybody here knows our wonderful Dr. Weeks, but I'm going to give y'all a brief intro. We have the full intro in our email. There's a lot of really cool background that you may not have known about Dr. Weeks before, so I encourage y'all to read it. Dr. Weeks is going to be presenting on herbs for mental health today. And as many of you are aware, she's faculty supervisor at Bastyr Clinic, and she's an assistant professor in the Department of Botanical Medicine at Bastyr University, California. She teaches our botanical medicine courses, including edible and medicinal plants, as well as several really awesome electives that we have here. Her clinical interests include a focus on botanical medicine, family medicine, women's health, autoimmune disease, diabetes, anxiety, and depression. And her healing philosophy is that she believes in empowering patients to balance their lives with herbal medicine, homeopathy, counseling, and nutrition. And she also encourages patients to seek fresh air, adequate exercise, social wellness, spirituality, and their own purpose to achieve health. There's a bit more information in this week's email, including her past work experience, as well as her education and affiliations. So I encourage you all to check that out. I'm going to go ahead and pass the mic on over to Dr. Weeks now. And I will encourage everyone, if you're willing, to please turn cameras on.
Hello, everyone. Thank you so much for having me for this. This is kind of exciting because I get to teach you in your usual class setting, but today you're having me as guest, and I feel really honored that that you'd be interested in hearing even more from me than usual. So we're going to talk today a little bit about using botanicals for mental health, which is probably one of my favorite things to talk about with botanicals. And so I have a lot to say. So I'll try not to speed too fast. So if you need me to slow down a little bit, but there's so many things I wanted to talk about that I'm kind of excited. So because it is November and it's Native American Heritage Month, I do want to start out by reading the Bastyr University Land Acknowledgement before we start talking about the topic today. So we acknowledge that the lands on which Bastyr University stands and on which we are holding our gathering today are the traditional, ancestral, and contemporary lands of the indigenous peoples, particularly the Coast Salish peoples in Kenmore and Seattle, and the Kumeyaay peoples in San Diego, California, whose spiritual connections to these lands form the foundation of their ways of being. We recognize and esteem the values, vast knowledge, and collective wisdom of these nations from the past and present. We honor their resiliency as we recognize the history of oppression, racism, and extreme hardship that has and continues to affect their communities. We at Bastyr University endeavor to be stewards of the land on which the institution stands, embrace Indigenous ways of knowing through our programs and initiatives, and strive towards policies and practices that will bring about justice and reconciliation. Okay, so go ahead and share some slides here. So in order to not repeat a lot that you'll hear me talk about in your classes, because some of you have already heard me talk about nervines in class in Materia Medica. We'll review a few of those. Some of you haven't had that yet, but some of you, so you either had it or you will have it in Materia Medica, where we talk about nervines, which, when we're talking about, our emotional state, that's usually the herbal action that we're looking for. We might also be talking about adaptogens, and you've also had some exposure to those, or we will be talking about those a lot. So I do want to cover that a little bit. So some of this will be a little bit of a review, but we'll try to delve into it into it in a slightly different way, and then bring in some other things. So when we're talking about our emotional health, that means a lot of things, and I think that's probably the most important thing that we can take away from talking today is that our emotional discomfort or our emotional well-being can come from a lot of different things. So trying to get, to treat the cause, that's going to be our ultimate goal. So when we're talking about emotional emotional distress or emotional well-being. We can be talking about things like anxiety and worry and depression, grief, loneliness, that kind of thing. But there's a lot of physiological things that I want to make sure that we're talking about. Our nervous system being out of balance can cause a lot of those things, and so looking at that and helping to restore the nervous system can be really important. The other thing that you want to always make sure that you're looking at with mental health is nutritional status of yourself or of the patient or whoever you're assessing their emotional health, because things like B vitamin deficiencies, iron deficiencies, essential fatty acid dysregulation or deficiency. Just those physical or more physiological elements can really, really contribute to emotional well-being. So making sure that we're looking at those really before we look at any botanicals is really important. So even though I'm focusing more on botanical medicine, make sure that before you even go that direction, that you're looking at the cause. Is this a nutritional imbalance, and can we help it just by helping with diet improvements or supplements or that kind of thing that are going to really address that baseline nutrient component. And of course, there's environmental things, whether, there's relationship concerns, there's environmental issues that can really help play a role. So looking at the context of the person's emotional state is really important. And so once you've kind of assessed all those, as you all are, learning how to do in many different ways, then we can start looking into the botanicals. So the botanicals can definitely address nutritional deficiencies. They can definitely help us with our nervous system imbalances, and then there's a lot of other hormonal regulations and things like that they can help us with. Um, I always like to, when I'm thinking about mental health, I like to go back to the traditional Chinese medicine organ systems, because sometimes when we're assessing mental health, it's kind of tricky to know where to start. But sometimes, if we're looking at our organs and you see emotions showing up, then we know that we can address those organ systems and have some effect on the emotion. And so you can also go the other way. If you address some of those emotions, you can have an effect in healing that emotion or that organ system as well. So just the super basics, and I totally encourage you all to look deeper into the 5-element theory and the organ systems in traditional Chinese medicine. But just sort of the basics is, if you're having a lot of anger and irritability, there might be an underlying liver concern. If there's a lot of fears that are happening, a lot of nervousness, fear, that type of thing, that can be an underlying kidney issue, imbalance. You often will see that with some low back pain and some knee pain, so you can tie in some physical elements into in with that emotion. And the traditional Chinese medicine sort of picture of the heart has to do with excitement or overexcitement if it's too stimulated, and love. So if we're having concerns about a heartbreak, we can definitely look at nourishing the energetic heart and even the physical heart, and that can help heal and release some of those emotions that get sort of stuck there. And then the lung, if we're having respiratory concerns or if we want to address grief and sadness, we can help with lung trophorestoratives and nourishing the lungs, and really be addressing the underlying cause. And then the same for the stomach and the digestive system. When there's a lot of worry going on, sometimes we're having trouble sort of digesting things, both emotionally and physically, and so we can look at our digestive system that way. So Hannah is asking, let's see, mid-back pain would be associated in terms of traditional Chinese medicine. I'm not positive. I would have to look that up. But, you know, when you look at where the mid back, you know, that's very much in line with the stomach, I would say. If it was a little bit higher, you might be looking at the heart, but I would start looking at, you know, sort of that solar plexus area and the stomach, but that would just be where I would start. So, cool. Let me know if that helps. So then, you know, when we're doing some healing, you know, once we sort of identify the direction that we need to go or identified the underlying cause, we do need to make sure that the context for healing can happen. So even if we're going to, you know, even if we're giving the person all of the right supplements and all of the right exercises and all of the right, you know, diet and all of that, the body needs to be in a place, the mind needs to be in a place where it can heal. And I think that that's something that we need to take into account, because, you know, if the person isn't in an environment, in a safe environment where healing can happen, it's not going to happen, even if we give all of the things necessary for that. And so that well-balanced environment, you know, is something that we need to work for. And sometimes it's really hard to do. Sometimes people just aren't in a setting where healing is easy, you know, happens naturally. You know, and you know, when we do help the setting, people do tend to heal naturally. So when we have a good diet, when we have, you know, enough fresh air and sunlight, and we're connecting well with people, so, you know, socially, and we're getting enough exercise and good hydration and good sleep, then things are going to naturally to heal. So our vitality is just going to naturally do that. So looking at that and making sure that the setting is ready for healing. So plants are amazing allies in well-being, of course, in general, but also in our mental health. And you know, sometimes looking at mental health and sort of addressing that sort of mind, spirit, body connection, we can almost help all of our ailments by addressing mental health. So, you know, and so using our plants, you know, as allies to do that, you know, plants are able to transform air and light into usable constituents for us, which is pretty cool. And plants are connected both to the earth and to the sky, and so they can help us sort of connect that way as well. So I mentioned a little bit the herbal actions that we want to be looking at, and this is sort of a reductionistic sort of viewpoint, because really we're looking for, is that a question or is that a, okay. So really, you know, looking at herbal actions is kind of reductionistic. It does help us sort of plug and play herbs, which we do need to learn that, especially in a medical setting. But one of the interesting things about plants is that they're whole beings, just like we are. And so just, you know, to say that something is a nervine or is an anxiolytic or is adaptogen, it's kind of like telling someone your name and address and where you went to school. So it is helpful information, and it does sort of put things into context, but it isn't in any way sort of really helping you get to know the plant. That takes much more of a relationship. And just like people, you know, like that wonderful thing that you shared about all of my statistics, you know, in the introduction here, definitely gives a context of who I am. But to some people, I might, you know, have a conversation about horses, and with another person, I might have a conversation about my cat or my past or something, you know, like that. And the same with all of you and every person you interact with. It's the same with the plant. We learn these statistics, we learn the Latin name, we learn the constituents, we learn their actions, but it isn't until we really have a conversation with those plants that we start to understand more of their personality. And they'll be different for each person, because our conversations with the plants are going to be different, you know, one plant to the next, but also one person to the next. So sort of those those herbal actions that we're looking for. We're looking for anxiolytics, which are going to help us with the anxiety, our nervines and adaptogens again. One of my favorite sort of herbal actions to look for mental health is our antioxidants or anti-inflammatories, which are nutrients, because those play a really big role. Our digestive tonics, it's amazing how helpful those can be for mental health. And it seems kind of funny, to be giving somebody bitters for their mental health. But if they're having trouble sort of digesting their life or processing their life, they're probably also going to be having digestive challenges and difficulties processing their food. And so if we're giving digestive tonics that are going to support the liver, that are going to help with peristalsis, that can be tremendously helpful on an energetic level and an emotional level. I also love using aphrodisiacs as, in mental health, because they give that sort of well-being or sort of that warmth and sort of that love of life feeling that can be really helpful in helping us reconnect with our bodies and reconnect with sort of with our soul, really. Antispasmodics, so helping with muscle tension. It's amazing how much of our energy and our emotions we get stuck in our body, in our muscles. So, our muscles hold on, trying to protect us, really. So our muscles are trying to protect us from whatever is happening on the outside or whatever dangers that we're perceiving. And so if that's the case, if we have people that are really trying to protect themselves and they're doing that, their body's trying to protect them with muscle tension, helping the body process that and release that, it can be tremendously helpful for mental health. So some of these herbal actions aren't the first ones that we would think of, and that's really where the art comes in. And of course, we always need to be remembering that, these are not these therapies themselves don't take the place of a therapist or a good medical practitioner that's working with a patient, but these can be tremendously helpful in addition to that. So some of the herbs that I want to talk about today, one of my all-time favorites is Stachy's. Stachy's officinalis. It used to be called Botanica, which is its more magical name. If you read back into the more magical text, you'll hear about Botanica. And it used to be what it's called. I'm not sure why they changed it to Stachy's, but it's still, Stachy's is still a fun word. So it's very comforting. So Stachy's, when we take Stachy's, now Stachy's is a really bitter plant. And so when you ingest it, it's got quite a bitterness going on to it, which you'll find to several of these plants that we talk about today. I mean, there's a lot of plants out there that are bitter, but several of our mental health plants are kind of bitter. And I think that those are the ones that, when I was talking about digestion and sort of helping us process life, our bitter ones are going to be the ones that are really good at that. Stachy's is one of those, so it's very comforting. It's very much like sort of, I imagine, Stachy's sort of, covering us with like this really comfortable blanket and cup of tea with a blankie kind of thing. And they really, Stachy's really helps with that mind-body disconnect, which is one of the first things that when we start in experiencing, mental trauma or mental distress, we start separating from our body. And so helping us at the right time, I have to say, start connecting back in. Sometimes that disconnect is a protective mechanism. And so, we need to respect that the body is doing that and waiting until the time is right, waiting until the person is ready to integrate back with their body, can be really important. So having sort of that holding space for the fact that that disconnect is actually very protective. It's just, over time, we do need to start integrating back to our body. So Stachy's can really help strengthen our solar plexus, so sort of help with the digestion, again with that bitter aspect, but also with our gut instincts. And so, as you all are probably familiar, there's a lot of nervous system in the digestive system, and a lot of our brain is in our gut, essentially. And so when we have our gut instincts, when we have those impulses, if we've stopped listening to those, we'll have concerns with our digestion. We'll also have issues with the solar plexus. But the reverse can happen too. If we're having problems with our digestion, then our brain and our gut we're not listening very well. The pathways start to get inflamed, essentially. So if someone's really feeling out of touch with their gut instinct, either because they've ignored them for a long time and developed some digestive issues, or because our digestive issues have caused a disconnect between our digestive system, or our gut, and our minds. Stackies can really help with that, and other things that affects the solar plexus can as well. So the symptoms that you'll kind of see with Stackies, dizziness, forgetfulness, difficulty concentrating. Stackies can be phenomenal in helping with that. So then we've got Tilia, which this is linden flower, and there's entire festivals for Tilia in Europe because it is just such a wonderful. It just makes us feel good. And so we dedicate entire holidays to Tilia, or at least we have in the past. I haven't heard of it. Well, I think they do still do it in Europe sometimes, but so Tilia is really great for calming the nerves. It's also used as an anti-inflammatory for fever and whatnot, but I tend to use it more often for its mental health actions, I guess. So really, really nice for sort of that fluttery nervousness that people will get sometimes. So it is really helpful for introverts who feel like they need to sort of put themselves out there but have a lot of fear in regards to that. So it can be really helpful in allowing us to communicate more confidently. It's also really helpful for transitions. So if people are having a hard time transitioning through life, but I've told this story before, so some of you might have heard this, but I was helping to start an offsite clinic that we don't have anymore. It was called Operation Samahan, and it was out in El Cajon there in the San Diego area, and we had a lot of patients with anxiety, a lot of of uh, of uh, of undocumented immigrants and other people with a lot of mental health problems. And somebody had donated a whole pound of Tilia, and we didn't have a whole lot else out there, so we had a couple of supplements, but Tilia was a big old thing of Tilia. And so pretty much anybody that came in that was having anxiety, we'd give them a little baggie of Tilia, and they would, instruct them how to make a tea that they could drink every day. And I have to say, of all of the herbs I have prescribed to patients, which is a lot, I have had more positive feedback for anxiety with Tilia than I can say any other connection, because everyone who came back after taking Tilia for anxiety was just thrilled with how much better they felt, how much more confident they felt, and it was, I should have written it down a little bit more, because there was probably 10 patients at least that came in with anxiety, and we over the course of a couple of months, and gave them all Tilia because that's what we had, and I just like the feedback we got was really phenomenal. So Tilia for anxiety, like I've just seen some extremely positive things. The irritable bowel syndrome, so people who get anxious and then they have some diarrhea, that type of symptom, Tilia is really helpful for. People who feel their anxiety in their head, so tension headache type things can be really helped with Tilia. But I can't say enough about how Tilia can really help with especially that sort of fluttery tension sort of anxiety that people experience. So if you need to calm the nerves, it's a really great one. So then Withania, you all have heard 1,000 times about Withania, but it is worth hearing about that many times. So this is ashwagandha, and when I think about plants, when I'm connecting with somebody about their mental health, trying to get a feel for where they feel it in the body is really helpful. And if I feel like they need to be grounded a little bit, maybe they're a little bit in their head, or maybe they just need to be a little more rooted. Ashwagandha root is really, really great. So it's very, very helpful for the nervousness and agitation, that people will get once they're exhausted. So if you've had somebody that's really been pushing through, and they're tired now, and yet they still feel nervous. So there's certain types of fatigue, some that's just there is no more energy left. In the case of withania, the body's still and the mind's still trying um, to keep things going, and so it's that nervousness that is because of exhaustion. And so, um, yeah. So it can be energizing, it can be calming, but really it has to do with the mental systems or the mental symptoms that happen from that exhaustion. And it'll help regulate sleep, which is where that somnifera species name comes from. It's related to the somnolence or insomnia. But it can help normalize sleep, and you don't have to take it at bedtime for that to be the case. It just will help normalize the nervous system so that the sleep comes easier. Um, and I most definitely couldn't talk about, let's see this question here. So how long would you have to take withania before you see effects? I like to give withania a little while, mostly because it is that mental health symptoms that come from exhaustion. Oh, Lyndon. Okay, well, let's stay with withania first. So I like to give withania a while to build up in the system and start strengthening the system, and then you'll start seeing that. So a couple of weeks for withania. Tilia, people feel better immediately. So it's you take a sip of Tilia tea, and you'll start feeling the nerves calm right away. Excuse me. Cool. All right, so I couldn't talk about mental health or any kind of thing without talking about Schisandra. And because it is that calming adaptogen, because it does act on all five organ systems, being the five flavor of berry, it really helps with focus. So if there's a lot of scattered thoughts going on, Schisandra can really help us focus. Um, it can really help with it's interesting because it is very calming, but also really helps with depression as well. And that, to me, it's because it's just so nourishing. It's so nourishing, both in a nutrient perspective, but also it's tropho restorative, so it's restoring the kidneys and the liver and the nervous system and just the whole body. So it's just so restoring that it has to have that effect on the mental health. The other thing that's interesting about Schisandra is there were some studies a while ago on using it for improving hearing and vision and sensory perception, which I thought was really interesting. Not so much related to mental health, but still a cool thing about Schisandra. So then Scutellaria, and this is the we talked about antispasmodics being helpful. So this is when somebody's holding their emotions in their body and their body is trying to help them. And so it's really relaxing to the smooth and skeletal muscle. So if you see anxiety or depression for that matter, um, you know, um, present with muscle tension, Scutellaria can be really, really great. It's also really helpful in calming fear. And so, if you have somebody that is fearful and maybe braced to protect themselves, this is a really good one. So I listed a formula for Dr. Hoffman from the textbook, his acute stress formula. So this would be something that you could take in the moment. And he had 2 parts of Scutellaria, 2 parts of valerian, 1 part Leonoris, some motherwort, and some chamomile and some artemisia. And so that would be an acute formula. You could do that probably in a tincture. This would be a really gross tea probably, but you could do it that way. And then the next one I wanted to talk about is Damiana, which not necessarily known for its mental health benefits, but this is an aphrodisiac. So I just wanted to talk a little bit about that, just because I feel like it's really important. It's a sort of an herbal action that we don't talk about enough because You know, when we talk about aphrodisiacs, you know, a lot of people will associate that with increased libido, and there's a lot of sort of snickering that goes along with that action. And Ternera definitely does have a little bit of that. It definitely can help increase libido. Um, it does it by balancing the hormones, though, and so excuse me. Um, so it can be really beneficial in addition to sort of amplifying those amorous feelings. But it promotes this sort of overall sense of well-being, which just can make, you know, it just improves the sort of mental health, the quality of our thoughts and the way we feel about life. So not necessarily, I mean, it definitely has an effect on libido, but it also helps us just sort of love love life in general and feel good about life. So it is, you know, tropho restorative to the nervous system. It is just that promotes that overall sense of well-being, and this is something that happens right away. You can, you know, that you can infuse chocolates with Ternera and have these sort of um, uh, you know, chocolates that sort of enhance, you know, romantic feelings. No, this is both. It's just, it's, you know, pretty much anybody is going to feel better with Ternera. um, and it is hormone balancing, um, and it is tonifying to the nervous system, but it does promote that like sort of warmth and you know, overall feelings of love, I guess. So yes, it's wonderful. I love Ternera. I love using it. Um, so then the next plant, this one's quite a different energy actually. So really, yeah, exactly, Rose. So you know, it is like, so Ternera is kind of like dark chocolate and red wine, and then extra because of the Ternera. So it is along those lines for sure. Um, so switching over, so Ternera is that very amorous feeling, and just sort of that well-being. Artemisia is a really interesting plant to use for mental health, and it's much more toned toward, or sort of targeting getting rid of the junk. So Dioscorides wrote a long time ago about it taking away choleric matter, and so that means in the digestive system, but also in the mind. So it gets rid of bitterness, it gets rid of anything yucky, anything that you need to let go of that for some reason has not been processed. Um, so, so taking a little bit of Artemisia just helps us clear out all of the junk. It's like spring cleaning for the mind. So if our issues are around a lot, you know, past occurrences, maybe we're still holding on to things that it would be healthier for us to let go of. Um, that's where Artemisia works really well. So it does that in the gut too. So it helps us purge. So, you know, and if we're using it for mental health, a little tiny bit is plenty because you're really looking at it working more on an energetic level. But if you want to use it both, you know, more on a physical level, slightly higher doses will do both. Um, so once we've cleared out the junk, then it increases our appetite for life. It'll also help normalize our appetite, you know, our actual physical appetite, but energetically, it helps people like want to take in more positive things because they've cleaned out the negative that was in the way of that. So larger doses can cause depression. So in both the digestive uses of it and the energetic uses, you just need a little bit. Artemisia is mugwort. It's the one that um, you know, you put, you know, in a under your pillow to help promote dreams, and most of the time they're healing dreams, so they can help us with you know, with processing subconscious things and getting rid of the negative again. Awesome. Good. Yeah, so definitely play around with your mugwort sleep sachets, and watch all of the negative be cleared out and some of the positive sort of come out in your dreams. So then Leonoris motherwort is one of my favorites to use for mental health. Motherwort is the one I use when people are nervous and anxious. With, a lot of times there's some tension associated with their nervousness and anxiousness, but usually it's around a transition in life. So if you, oh, okay. So um, if you are going through a transition in life, whether it's puberty or a move or the loss of a loved one or starting school or graduating from school and starting your new practice, that kind of thing. So transitions in motherwort, if there's anxiety or tension um, around transitions, Leonoris is amazing for that. Benny, what's up? Benny?
Sorry, yeah,
Okay.
I'm sorry. It took me a while to get. Yeah, no, I was just, I got here late, but you were mentioning first with the Demiana about how it just kind of generally makes you feel good with the aphrodisiac, and then with the mugwort, and I was just gonna ask if you had any. I know it's controversial, but kratom also is a really good herb for. I mean, it's really strong, but it just makes you just everything just feels right with the world. I mean, it's a little controversial because it operates on some opiate receptors,
Right.
but and then also with regards to dreams, I've really been experimenting with the Blue Lotus, and I find it's not the only problem is you don't necessarily have a restful sleep. You have a lot of dreams, but they're usually active dreams where you're doing stuff, so your sleep does not produce as much rest.
Right. No, that's very cool. And thank you for sharing that with both of those herbs. So, sleep is one of those things. Yeah, any of our herbs that we use to help, with dreaming, you do have to be careful because you don't want to overstimulate or, because you do need to get the restful sleep. In regards to the kratom, it's not one that I've worked with very much. I do know people that do use it quite a bit, but yeah, and it is controversial, but I've heard some really great things about it as well. So thank you for sharing that. Let's see. So Leonoris, again, if there's palpitations or tension that have to do with transitions in life, it can be really, really helpful. So then going back to the idea of getting good sleep, California poppy or Schultzia is really, really good at that. So not so much in the dream realm, so Artemisia is definitely going to help us experience or be more aware of our dreams. California poppy, not so much. This is more about getting a solid night's sleep. And so if our anxiety, if our mental health isn't allowing us to sleep, Schultzia can really help with that. So it's a really nice calming plant, and um, and helps with normalizing sleep. And it normalizes it even to the point where, with children, if you have children that are wetting the bed, they're not waking up when they're supposed to. California poppy can help us normalize their sleep enough that even in children, they'll wake up when they need to, and go to sleep when they need to. And you can kind of see similar patterns with adults as well. Yes, I'll share the slideshow with you. I'll send it to Ryan so she can post it for you all. Um, so so California poppy, if sleep is being interrupted, or if it's contributing to our mental health issues, can be really great. So then let's see. I'm gonna make okay. Cool. So then verbena, vervain. This is another one very similar to stachyas in that it's a very bitter herb, so it's going to be helpful with our digestion and helping us process life. But verbena does tend to help with hormonal sort of um, hormonal dysregulation that might contribute to our mental health concerns. So pelvic congestion, um, if we're holding our trauma or if we're holding our stress in the pelvis, and that, is part of the mental health picture, then verbena can be really helpful for that. It is really great also for restoring parasympathetic sympathetic balance. So if our nervous system is off center, and a lot of times you'll see that happen, with trauma, where we're just sort of stuck in sympathetic mode, where we're not able to relax, we're not able to rest and digest. Verbena can help us sort of balance that and move into a little bit more of a parasympathetic tone. So verbena can also be for people who are really intense. So strong-willed, unable to relax. Again, looking at that nervous system imbalance. So if you're just pushing and pushing and pushing, and if you find it hard, which I find this really, really common, if you find it hard to relax, and I see this a lot of times where people who have this trouble will turn towards alcohol, especially to help them relax. So if you have somebody that just has to make themselves do something, like has to drink or has to, sort of make themselves relax, verbena can help us balance. So then you can actually like relax when you need to, when you want to, when you have free time, that kind of thing. So verbena is another one of those historically magical plants, and where you see that come into play is that it was used by ironsmiths to quench their ironwork, to harden it, and give that tensile strength to whatever ironwork they were doing. So that tension, we see that energetic coming into play. So it makes the iron more flexible and giving it so that it doesn't crack and break. Verbena is really good for that tension that we have in the body. So that stiff-necked remedy, or that like sort of intensity that people can get and hold on to and not be able to relax, it can help them be more flexible. So a couple of others that I wanted to mention, there's a bunch of others actually, I will leave this to you all if you want to read these later, because all of these are other ones that I wanted to talk about, but I knew I wasn't going to have time to. And then there's a couple of formulas if you wanted to look at these. Most of these I got from Jill Stansbury's book. So if you want a book or a series of books that has formulas in it, Jill Stansbury's books are really helpful that way with all of her formulas. Let's see. I wanted to talk. Only got a couple more minutes. Let me make sure that I'm talking about the thing that I want. Yeah, well. So the rest of this will be for you all to take a look at when you have some time. But I wanted to talk about essential oils. Yes, I will be glad to give you. Here, we'll put it in the text. So Jill Stansbury. Thank you, Samantha. So she's got a lot of really great formulas. So I wanted to talk a little bit about essential oils for mental health, just to put a plug out there. I don't use a whole lot of essential oils. I used to use them a lot more, but because of how much plant material it takes to make just a little tiny bit of essential oil, it's not the most environmentally sensitive way to use botanicals. And I've switched over to using a lot more incense, where you're using the whole plant and burning the resins, or powdering the herb and using it a little that way. So I use a lot more incense than I used to, and I also use a lot more simmer pots. So we'll show you a picture of these. But putting the herbs into like a crock pot or something like that, where you're using the whole plants rather than just their volatile oils or their essential oils. But the same sort of concepts that come into play when you're looking at blending essential oils can come into. You can use those when making incense, or burning incense, or when making something like a simmer pot. So you can go back here to the slide really quick. you can formulate these depending on the mental health sort of concern or topic that you're looking at. So in the old fashioned perfume blending system, you have top notes, middle notes, and base notes. And these different notes are going to have an effect on our mental health. So the top notes, which are very elevating, are going to be really, really helpful for depression. So our citrus and our mints and our lemongrass, those types of scents. Lavender does everything, so I think it can be in all of the categories. Our middle notes are very centering and they're very balancing. And so ginger and camphor and ylang ylang. And then our base notes can be very grounding. So they help us get out of our head and into our body. And those are a lot of resins like frankincense and our woods like cedar wood and pine and those kinds of things. So using those concepts and incorporating those into into a more olfactory way, like using them as as incenses or simmer pots, we can take advantage of those essential oils, but maybe be a little bit more environmentally friendly. That's awesome. Yes, I love simmer pots. I've been really into those, but formulating them to help us with our mental health can be a lot of fun. And I just wanted to sort of throw that out there because it's been something I've been doing for my own mental health, and I've been recommending these to patients lately. So I wanted to share that concept with you. But you would use your same philosophy, like using the essential oils and those formulations for that. So I'm going to go ahead. I did have a few slides about flower essences and a little bit about sleep sachets, but you all know about those a little bit. So, but I would love any feedback that you have if you try any of these things. Send me an email or chat with me in the hall or in passing, because I'd love to hear about it. So I'll go ahead and end there. And if you have any questions.
Can I ask a question? Sorry,
Yes.
you're about to say what we were supposed to do. Sorry.
No, that's okay. Ask me a question.
So with these herbs that are good for mental health, are there any contraindications that we need to worry about? Say if a patient is on lithium or an SSRI or just any contraindications?
I would always look up any drug interactions with herbs that you're using. If you're using the flower essences, those don't interact with medications, so you're pretty clear there. Your essential oils are usually okay. Your simmer pots would totally be okay. Your sleep sachets are going to be totally okay. But if you are going to prescribe a tincture or capsules, I would look it up for sure. Yeah, thank you, Ryan.
Okay, thank you.
Awesome.
Does anyone else have a question? Because I have another one, but I don't want to take up space.
Go
I
for
have
it,
a
Haley.
question,
Oh,
if that's
go ahead.
okay.
Yeah.
What do you have like a certain I guess company you like to buy your incense from?
I don't. I've been sort of I've been looking around to find some really natural ones, and I have found one. One of my to-do list things for this year is I want to take the aromatic school, Northwest Aromatic School of Aromatics. Anyways, they've got an incense making course, which is on my to-do list because I want to make my own. But I usually just burn the herbs or the resins. Like I've got an electric incense burner, and I'll just put the resins there. I also have a wood stove, and I'll put I've got a little cast iron, like little bowl, I guess, and I'll put my resins in there and just have them burn when the fire's on. So, but that's what I'm doing currently.
Okay, thank you.
All
Dr.
right.
Weeks, I have
Yes.
a question about addiction. I'm wondering if any herbs just jump out at you for that are well indicated in people who are struggling with addiction.
So addiction, of course, is, as you know, is a really, really deep subject. And so when you're looking at somebody that is experiencing that, you really need to get down to why. And then you need to create the environment for them to be able to move on from that. And so so you really have to look at what it's doing for them, or why they're medicating that way, why they're doing that. And then looking at nutrition and looking at their environment, and then choosing the herbs that are going to help treat that cause. So it's very much about getting to the cause of things. So no, I guess is the answer to that. You know, we talked about California poppy. It's been shown to help people get off of opiates. So they will use California poppy to help wean people off of opiates. And so there are studies like that where we've used herbs. Lobelia has been really helpful to help people get off of nicotine. And so there's a lot of that, but you really need to look at the cause, and then make sure that they have the nutrients and things like that to support, you know, that process.
Thanks. Thank you.
I don't want to interrupt or stop anyone else from asking questions, but I know Dr. Weeks, you have a class and you need to leave and get to school. So I did want to just give everyone a heads up. You can email Dr. Weeks or find her on campus or at class, and I'm sure she'd be happy to answer all of your rest of your questions.
Yes, I would love to hear your questions, because this is a topic that I really, I'm very passionate about this topic, and I would love to hear anything that you all have to say or want to learn. So,
Thank
all
you
right.
so much, Dr. Weeks. This is wonderful. I think we all really enjoyed it.
Yeah,
Good.
thanks again. Appreciate it.
Thank you for being there. All right. Well, have a wonderful day, everyone. Hopefully I'll see some of you around. Otherwise, send me an email if you have any questions, and I'll get this to Ryan or Crystal or Sam soon. All
Thank you so much. See you later.
right. Bye.